My name is Thomas Gerhardt. Right now I'm working with Dr. Alexander out of Affordable Dentures and Implants in Rochester, Minnesota. Well, the cause of damage to my teeth was multiple things. Poor hygiene. I feel bad that I haven't taken care of my teeth. Also, though, when I was in the service, played football and I had some damage there. Never got that taken care of because I just couldn't afford it. I decided to get my surgery now mainly because of the health issues. Was stationed in Guam for 18 months. And I returned to the States to do my final 8 months in Camp Lejeune, North Carolina, where I wound up getting some of that contaminated water that has caused me to have Parkinson's. I found out that I have service-related Parkinson's 1 week before I turned 60, this last June. So hard for me to be able to chew my food and swallow. Also, it's really affected my self-confidence. I'm afraid to smile. I don't want people to see my bad broken teeth. I heard about Dr. Alexander through several people that I know here in town that have had work done through them. And I've also saw the Affordable Dentures commercials on TV. It made sense. I like the idea of the implant and be able to have more like your natural teeth. That's the main reason that I decided to go with Dr. Alexander. That and the people that recommended him said he was such a great guy, and I found out for myself that he really is.
So Tom's consultation was it was a unique experience, and what I've realized working with a lot of veterans over the years is their level of sincerity and humility. He was so appreciative of just even taking the time to see him. Veterans in the United States are not eligible for a lot of dental services if they're not 100% disabled. Unfortunately, he has been afflicted with this Parkinson's disease that has not 100% made him disabled, but it's definitely a consequence of him being exposed to these chemicals in the war. It breaks my heart that someone who's gone through that and sacrificed his health doesn't have the access to the care that he needs. And so it really inspired me to find a way to provide these services for him at a level that he can afford. And we even decided to take it one step further and get him the very best treatment at no cost. So the process of repairing this patient's tooth condition took about the span of a week to plan. And so we reached out to our partners at Chrome Guided Smiles, partners at Rowe, and our partners at Strama Neodent in order to create and design not only a surgical treatment plan for Tom, but also the prosthetic. And so the process started with getting records. So he presented to our office. Just like any other patient, we utilize 3D imaging, the latest technologies in 3D scanning. And what 3D imaging allows us to also do is design his surgical procedure, not from looking at the surgery and then trying to end with a prosthetic, but designing the prosthesis first and working backwards in order to achieve the optimal placement of not only the implants, but the surgical bone reduction and surgical placement of the dental implants to optimize the prosthetic. And so what does that mean? That means designing what we would like Tom to look like, getting his feedback on what he would like his smile to look like, and taking into consideration how we want the teeth to come together, how we want him to be able to function and to eat, and using that design and working backwards in order to specifically tailor the surgery to get the result that we want to have.
I am very happy with the overall outcome. I guess I wasn't exactly sure how it was going to come out for me. You always expect the worst. But the first time that I got to see my smile after I had this procedure done, that made it worth it for me. My experience with Dr. Alexander and his team was awesome. They're utmost professionals. Well, for me personally, the biggest thing is being able to eat and chew my food properly. Just being able to smile and feel like a normal human being, and I can walk out in public again. Well, the first time that Dr. Alexander gave me the mirror and I was able to see the outcome, I was in shock. I really was. I mean, I couldn't believe what he was able to do for me. It was like, it didn't seem like it was me looking back in that mirror. And to be honest, I got kind of broken up, because I couldn't believe that somebody would go out and do something like this to help me out like this. And I am eternally grateful to Dr. Alexander, and I will do whatever I can to help him and to hopefully to bring people out so they can see, what I see and feel what I feel, because my life is going to be changed totally because of this. And I got something to look forward to. I'm 60, and to be honest with you, before I had this procedure done, I wasn't looking forward to seeing 70, but now I'm looking forward to it now. I think that I have a decent chance at a decent outcome. Compliments all the time about how well my teeth look now, and how people have been able to see me smile again, which I wasn't able to do for the longest time. So I'm extremely happy with it, and I would highly recommend it to anybody that's considering it.